Hi, thank you for tuning in today. Today at Vista Gardens, I'm on this beautiful patio today thinking about actually depression and Alzheimer's. And the reason is, over the last couple weeks, we've had quite a few new admissions with depression. The residents very visible symptoms of depression, not your typical apathy and withdrawal, but more active crying and isolation, weight loss. And it seems like the physicians have really not caught it. Or there was some resistance to the medication regimen. Sorry about that. So one question is it Alzheimer's or is it depression? Early on we talked about the 3 Ds, dementia, depression, and delirium. And they have overlapping symptoms. So when you think about Alzheimer's, you think about inability to concentrate, memory loss, cognition problems, sometimes lack of appetite or forgetting to eat, sleeping too much, impaired concentration, but all those things can also be depression. And I think physicians, maybe due to the patient not being able to articulate what's going on, or they may not have spent some real concrete time with them, some quality time in the session going over the geriatric depression scale or asking key depressive questions that might trigger an answer, is this depression or not. With Alzheimer's disease, it's clear in the literature that about 50% of patients with Alzheimer's do have depression. Some studies are higher, some are a little lower. So anywhere between 42% and you see 60 in the research. And many famous people have studied depression and Alzheimer's. One of them who keeps coming up in my literature review is Dr. Robert Wilson at University of Chicago, a really famous guy who's gone over early signs of Alzheimer's are so hard to detect. You know, we just don't know in your 50s, what you're gonna get in your 80s. However, he feels an early sign would be depression. And a real significant depression, like within the first 8 years prior to MCI, mild cognitive impairment, or any memory loss coming on with the Alzheimer's. He feels depression comes on first. And he feels with treatment of depression, such as therapy, SSRIs, interventions early on, will help reduce Alzheimer's disease and also help with the symptoms. And when you read a lot of the literature, it'll say, you know what, people with Alzheimer's have so many frustrated moments of frustration, negativity, resistance to care. All that is really difficult, and an antidepressant, a happy pill, isn't going to hurt them. And Dr. Jeffrey Cummings, who I've mentioned many times, a famous psychiatrist in geriatrics, he had many talks early on at UCLA on antidepressants and Alzheimer's, and how that really should be something we look at first before we jump as physicians to tranquilizers, sedatives, benzodiazepines, whatever they are. So physicians really need to be looking at first, is it depression? And maybe doing the geriatric depression scale again, or ruling it out in some way, looking at resistance to care, sleeping too much, lack of appetite, all those signs. And when you think about it, if the depression's treated and the memory loss still exists and the concentration's that poor, most likely it's going to have to be looked at by a neurologist to really assess for Alzheimer's, because you've treated the depression, so now what? So depression is just, the reason I'm bringing it up is just constantly overlooked in our field, and maybe because some people have been living at home too long and they've isolated, there's no social interaction. So this isn't a whole bleak talk here. I want to go into some positiveness, which I think is, what do you do when you do have that patient with Alzheimer's and depression, and we're in an assisted living setting like this or at home? It's clear in the literature that most suggestions are sunshine, that's why we're sitting outside today, exercise, therapy, and possibly a psychiatrist that needs to intervene, and hopefully a geriatric psychiatrist that's specializing in our field. So those treatments really can help. An active social life. What is that? Well, in a facility like this, it's going to bingo, it's taking a walk, it's doing the gardening, it's attending music, it's getting out of their bedroom. And I think it's difficult. Some people who've been depressed their whole lives, to come here and live and go outside of their bedroom is hard. However, getting, at least that older adult out of their room for 50% of the time is critical. They need to engage. And of course, exercise is important too. A facility that has walking space, or they can go outside with a caregiver. Those are just all really great ways to combat this terrible depression that looms over them. Another issue is, we really want to make sure when we talk about depression that we decrease the social isolation. And living at home, it's tough being socially isolated. You're not only at home alone with the TV as your friend, you just aren't probably not going out to Bridge anymore or the senior center, because depression sets in and it's more difficult. So scheduling things for them to do is critical. Making sure the caregiver knows, let's go to the movies once a week. Let's try grocery shopping together. Just getting out of the house is really important. So if you have any questions at all, I encourage you to look up some literature also on Dr. Laura Boxey. She's from Ohio State, Boxley, I believe. She has some great articles on depression and Alzheimer's. Jeffrey Cummings, you can always look at. Dr. Robert Wilson has a ton of research. He's in the Journal of Neurology a lot. So just keep looking. The Mayo Clinic has probably one of the most impressive pull downs. If you go click on to depression, you'll see the different various links to Alzheimer's disease and different diseases, MS, everything, and you can type in Alzheimer's, and they really do have quite a bit that you can read on it. So any other questions, feel free to call me or email me. Thank you.